Welcome to the Digital Health Pulse. I'm Trevor Yasinow. Let's jump into today's conversation. Hi, everyone. Welcome to another episode of the Digital Health Pulse video series with myself, Trevor Yasinow. I am joined today by Mike Tomback, Senior Vice President of Sales at Ciba Health. I've had the pleasure of knowing you, Mike, for, probably 4 years now, which is crazy to think about. So welcome and thank you for being here.
Longer. It's good to see you again.
So, Mike, happy to jump into it. My first question for you is, can you tell me more about Ciba Health?
Yeah, I can. And to really get into the nitty-gritty, it would take probably a couple of hours, but I'll try and keep it at a high level. So we provide an integrated virtual care platform which delivers a very personalized program, and it's based on root cause medicine. What does that mean? It means that what we do is we offer a whole population solution for our organizations, and typically we deal a lot with employers and other types of organizations. But it's a model that's designed to do a couple of things. One, first and foremost, we are looking to reverse a number of the most chronic diseases that these organizations are dealing with their employees, and the employees' dependents as well. So, we tackle cardiometabolic disease, we tackle digestive health issues, we tackle autoimmune disease and more. And then we also have an approach that will provide prevention of chronic disease for those individuals who might be on the cusp. So we can predict incidents of chronic disease before it occurs. The way we go about it, and this is what's important about Ciba Health, the way we go about our program, and again, I'm going to say this many times, it's more personalized than anything else on the marketplace. So root cause medicine, what that means to us, it's kind of a three-pronged approach. So we start with very advanced labs. What we're looking at is we're trying to see what's under the hood, people with some of these diseases, like type 2 diabetes. And we'll use that as a really strong example because that's what, the prevalence is only going up. But we provide labs that will measure up to 300 different biomarkers. So if you think about your annual physical examination, you're only getting a fraction of those, and you will learn from these labs things that you've never even heard of. We're looking at things from these labs like inflammation, like what's going on in the gut. Gut health is very, very important in addressing chronic disease. We're looking for the presence of toxins and heavy metals in the bloodstream. We're looking at micronutrient deficiencies. A lot of people who have chronic disease, are going to be deficient in maybe vitamin D, vitamin E, and that sort of thing. So we're really looking at everything that's contributing to disease. So that's kind of the first leg of root cause. The second leg of root cause is um, it's the connected devices, and a lot of digital health programs will offer a scale, blood pressure cuff, in some cases, continuous glucose monitor. We offer all of those, but we also offer a tracking device. So typically we'll use a Fitbit. What we're trying to do is not only track activity, but we're trying to track the quality of sleep as well, which is really important in tackling chronic disease, right? And we're also looking at things like their heart rate and that sort of thing. So we're getting all of this input on a real-time basis from the devices. We've got the labs. That third leg of root cause medicine is really the most important, and that is that we lead with the human element. So every participant who goes through our program is assigned a dedicated care team that stays with them through the entire course of the program. That care team leads with a physician, and these are all Ciba Health employees. But we lead with a physician, and you have sessions scheduled with a physician that last up to an hour. And most people react like, when's the last time I've ever spent an hour with my doctor, right? So that's a really important element of what we do. That care team also consists of a certified health coach and a registered dietitian, and these three are all working together in tandem to help create a very personalized program for you as a patient. And then that care team is also supported by nurse care managers who do a lot of the coordination internally and externally, as well as we have behavioral health specialists on staff as well for those people who need them. And it's really, really important to note that we don't have any particular diet that people need to follow. We don't go ketogenic. We don't say your plate needs to look like this. And we don't have a particular exercise program that says, yeah, walk 10,000 steps a day. This really is each program is created individually for each patient based on what we've learned about them from all of that root cause assessment.
That's incredible. Thank you. And so I guess to summarize and from your understanding, what makes SIBA very unique compared to others in the industry? We hear about chronic condition management so much. That's a big driving factor of claims costs. So I'm just curious from your perspective.
Yeah, yeah, and actually, we really do have a lot of very significant differentiators. When I talk to organizations and they say, "Oh, you guys do diabetes, must be like these guys, and you do digestive health, you must be like these guys." We're really not. So some of the differentiators include, first and foremost, the level of detail that we're trying to understand based on that root cause medicine approach. We treat the whole person, so a lot of people with the types of diseases that we encounter and that we treat have many comorbidities. So once you heal what's going on in the gut, once you get rid of inflammation, um, you're really curing everything that's wrong with that individual. Another, excuse me, another significant differentiator is that we're not trying to manage these chronic diseases. We focus on reversal, and we are successful in reversing chronic disease in 90% of our patients. So, what does disease reversal mean? That means that your markers look the same as somebody who's never had that disease. You can, if you're a diabetic, or if you had lupus and you fall back on other habits, you're going to get that disease again. And that's why our program really needs to be sustainable. So what we're trying to do is not change someone's lifestyle. It's trying to find simple swaps that fit in with their lifestyle. Another differentiator is that we have one program, one platform that tackles these multiple different conditions that I mentioned. So and every patient has a very consistent journey. So we're not trying to be everything to everybody, but we do provide a broad spectrum of care under one platform. So we eliminate a lot of the point solution fatigue that people are feeling these days, right? And then we've got, that word personalization again, because of the depths that we go to understand what's going on, we're personalized like nothing else on the marketplace, in my personal opinion. Um, Another differentiator is some of the creative elements that we've put into our program. So, for example, we have a food as medicine program that's part of what we do for individuals, so that we're able to provide them with healthy food delivery and that sort of thing to further jumpstart their health journey. And I would say, last but not least, is that, as you probably know, one of the two biggest barriers in digital health and wellness are engagement and outcomes. And we've got those licked. So, we see 75% of the people who enroll in our program completing the 1 year program. And we do offer maintenance past the year, but we're only seeing 25% attrition. And there are a lot of reasons for that. But, one of the main reasons is that people start feeling better and start reducing their medication in as soon as 6 weeks. So you start to get momentum very, very early on. And it's because it's a very, like I said, sustainable program that people, who've tried other things and couldn't cut out whole food groups, for example, or couldn't keep up with the exercise requirements. They find that what we do, or what we offer, and what we try and get them to do is very, very manageable. And then, so that's engagement. And then on the side of outcomes, I think I mentioned 90% disease reversal. We are eliminating medication across the board for all disease states at a rate of about 85% medication reduction.
Jeez, that's incredible. Yeah, I mean, medication, that's the number one driver of claims today.
Absolutely.
So being
Absolutely.
able to, reduce that is pretty impressive. And I
Yeah.
think you alluded to it
Yeah.
earlier, but who are your primary customers and how exactly do they benefit from the solution?
Yeah, that's a good question. We do work with a number of different types of organizations, primarily employers, mid-sized and large employers. We also work with some third-party administrators, and we're in discussions with health plans. We work very closely with a lot of employer groups, a lot of the regional business group on health types of organizations. The benefits are, it's pretty cut and dry. The benefits are both for our clients and for their members, obviously. For our clients, they're seeing a strong return on investment. You start to cut out this medication and reduce hospitalizations and reduce ER visits, you're going to get a very strong return on investment right away. And then in tandem with that, there's a big increase in productivity, decrease in absenteeism, and then you're just really promoting your population health. There's also that risk aversion of people with a certain disease that could potentially progress. And when you think about, for example, for prediabetes, something like 35% of the adult population in the United States has prediabetes. What happens if you do nothing? Over the course of the next 3, 4, 5 years, they're going to be full-blown type 2 diabetics. So it's that risk mitigation as well. For the participants, obviously, it's a huge lifestyle improvement. They're cutting out their medication, they're living their life to the fullest, and they're achieving that goal in a way, again, that's very manageable, very sustainable over the long term to them.
It's incredible. So what is one exciting trend that you're seeing in digital health right now?
I would say the most exciting trend that I'm seeing is that people are actually seeking out our type of solution. We're about 5 years old now. And in this industry, it's pretty crowded. You have to start out making a name for yourself and building credibility, right? And then we started promoting root cause medicine and disease reversal. And we found a number of employers and consultants were very intrigued, and we grew that way. But now people are actively seeking out this approach, and they're saying, you know what, some of the legacy types of digital health solutions and chronic disease management solutions aren't working for our population. We're not getting the engagement. We're ready to try something new. So that's really, really exciting. And we fit right into what people are looking for these days.
It's incredible. Yeah, everyone hears so much about point solution fatigue, right? So
Exactly.
being able to solve that and get savings is checks all the boxes. So
Yeah,
great to
yeah.
hear.
And people look at our statistics and say 85% medication reduction, you guys are nuts, or 75% engagement, you guys are crazy. We have very strong performance guarantees that will support what we do.
Wow, guarantees.
Mhm.
That is a key word for buyers in this
It's a
market.
requirement these days, absolutely.
Yeah. So what does the next year look like for Ciba? Are there any big goals or milestones on the horizon?
Well, I told my colleagues last year was a really big year for us. And I said, buckle up because 2025 is going to be a big year. And it started out really, really strong for us. If you look at our roadmap, and I'm not going to go into details about the roadmap itself, but we continuously improve our program without going over our skis. And things like embedding food as medicine and that sort of thing. So what we're going to try and do over the course of the next year is diversify our client base. We're going to try and work more closely with health plans. We have a GLP-1 step therapy program, and we're going to try and employ that more broadly to help control the increased use of GLP-1s. I should say use and misuse of GLP-1s, right? And I would say the other thing would be the continued, and this is really important also, the continued development of AI within our program to do two things. One, to better, to provide more ammunition for our care teams to better support their patients, and then also to help predict adverse conditions in individuals before they occur, so that we can keep people healthy, keep them from going out of range. So we've got a lot of very lofty goals, and it's going to be a fun year.
Exciting. Yeah, one thing that stuck out to me, what you just said, is incorporating AI, but also not losing that human interaction. That's the
Absolutely.
key.
We're always going to lead with the care teams. Absolutely.
It's incredible. Well, Mike, it was great to learn more about what Ciba is doing in the digital health space today. I'm looking forward to seeing all the exciting things that the company will be doing. So, thank you so much again for joining me
No,
today.
thank you, Trevor. Thanks for inviting me.
That's a wrap for this episode of the Digital Health Pulse. A huge thank you to my guest today. If you enjoyed this conversation, be sure to like, repost, share, and follow for more chats with the top innovators and leaders in digital health. Have a company you'd love to see featured? Drop a comment or reach out. Thanks for watching, and I'll see you in the next episode.